entire quad. It's kind of like a blanket, blanketing the entire quad on the cat, right? And this, the name of this first quad muscle, so this is a quad, I'm starting with the quad groups first, right? The most superficial quad muscle here is what's called the sartorius. Sartorius, the notorious sartorius, right? That's this muscle here, right? Do you guys see that? Right, so what you're gonna do is after cleaning this region, you guys are kind of like look out for the borders. And then you guys are gonna try to get underneath that muscle, just kind of like the hypaxia muscles. Like, you guys remember how we like went in and separated the muscles from the deeper muscles? You guys are gonna get a probe and clean it. And when you get to about the distal region, towards the knee, you guys are going to snip that muscle to expose the muscles deeper. Does that make sense? Right, so first muscle that we're going to deal with, again, is called sartorius. Right? Just deep to sartorius, right? We have what looks like a hot dog bun or something, kind of, and it's terrible. But do you guys see? So like the sausage part, the center region, right? This is a very straight muscle, right, by the femur. So it's called the rectus straight femoris muscle. So we have the muscle just deep to sartorius called the rectus femoris, right? And to get to it, you're gonna sort of find the borders, get underneath it just like last time, isolate it, and then snip it at the knee once more, right? And then you're just gonna wreck it out, right? It's actually really tough, so you have to really like wreck out rectus femoris. So that's this middle muscle here, right? And by removing that out, you're actually left with the vasti. We have 3 vasti or vastuses, and they're named after its position. So we have like a vastus medialis, a vastus lateralis, and a vastus intermedius, right? Located exactly where you think it would be located, right? So like this muscle on this side, on the outer side, is probably vastus what? Lateralis. The one towards the midline is medialis, and then the one between those two is the intermedius. Right? So that's vastus intermedius, vastus lateralis, and vastus lateralis and vastus medialis, and they are all part of the quad group. Again, if I pin any of those muscles, right, their innervation would be what? Femoral nerve. Good. Right. Their action is what? Extend what? Extend knee and flex the hip. Yeah, good. Good, good. Again, those are the kind of questions. Just get really comfortable with that. Sounds good? And that's all the quads. That's all the quads. So we had the 4, the rectus and the 3 vasti. They actually are what's the quad is like. That's those 4 muscles. The actual quad is those 4 muscles, and then part of that quad group is this superficial blanket called sartorius, right? Okay, the notorious sartorius. So, the hamstring group, again, is going to be on the opposite side. So they're going to be really juicy. There's just 3 muscles for hamstrings, right? And I don't know if you guys could see. Can you guys see there's a muscle here, and a muscle here, and a muscle here? Can you guys see that? Right, so there's 1, 2, 3. Can you guys all see that there's 1, 2, 3 hamstring? I'm going to try to point to you guys. So you guys see there's 1, 2, 3. Those are the 3 hamstrings. One of the first hamstrings here on the lateral side, right? It's like spanning the entire lateral side, but that's part of the hamstring group, right? Is what's called so this is our first hamstring muscle. It's called biceps femoris, right? Right? And this biceps femoris muscle, which is the most lateral hamstring muscle, the way I'm going to have you guys cut it is actually in half. I'm going to have you bisect it in half. Biceps femoris, bisected in half. Right? And by doing so, you guys are going to reveal something. And can you guys see on this side? Do you guys see this white structure, right? Does anybody know what this white structure is? Yeah. Oh, sweet. You guys already know. Crazy. I'm impressed. So do you guys see on this side, do you guys see this gigantic nerve? Right? It's actually pretty big. And this right here, ladies and gentlemen, is the structure that's going to make the difference between a 4.5 and a 5 out of 5 for your dissection points. So if you keep the sciatic nerve, right, you'll get a 5. But it's actually kind of tricky to keep the sciatic nerve because the way it is morphed is you have like the biceps femoris muscle, but that nerve is actually attached to the muscle from the bottom. So if you just go in and just cut it in half, the nerve will be severed in half. So what you have to do is you have to get underneath there and kind of feel for like a nerve and see if you can pick it out and then cut just the muscle. Does that make sense? It's very important. You guys gotta get in the habit of doing that because like if you're in real life and you're dissecting patients and you cut a nerve, they're just goner, right? So it's like make sure just like, well, their leg is a goner, but you just want to make it a habit where you're like just being careful of such big structures. Sounds good? So the A+ dissection structure again is the sciatic nerve. Right. So okay, again, so we're doing hamstrings. So we have the biceps femoris, big deal, right? And then we're left with the 2 semis, right? Those are the names of the other hamstrings. So I'm going to show you guys on this side first. We have the 2 semis. We have what's called semitendinosus and semimembranosus, right? And semitendinosus is the one that's skinny like a tendon. Do you guys see this one right here? Do you guys see how this one's pretty skinny like a tendon? So this is semitendinosus. And the meatier one that happens to be located more medially is semimembranosus. Does that make sense? So semimembranosus is the most medial hamstring muscle. And then we have semitendinosus, the skinny one. All right. And then, of course, we have the biceps femoris. And again, on this side, right, you guys see skinny like a tendon? And then meaty. Semimembranosus and semitendinosus. All those 3 muscles again share the same innervation, which is which nerve? Does anybody remember? Oh no, tibial. Yeah, tibial nerve. Good try though. Like, keep practicing. I really encourage practicing. But that's the hamstring muscle, right? I'm actually not gonna have you guys dissect out the glutes just because they're located so differently than the human. And after all, this is a human anatomy class, not a cat anatomy class. But I'll let you know that in the glutes heel group, there's gluteus maximus, medius, and minimus, right? Located superficial to deep. Does that make sense? Maximus on the outside, medius, and the minimus. Right? All part of the glute group, which has what action? Abduct the leg, or abduct at the hip. Any of those is actually acceptable. But right, good. So we talked about quads, hamstrings. The other muscle. So antagonist. Cat tooth on my face. Antagonist to the glute group again is the inner thigh area, right? They're opposite, right? These legs help you close the legs, right? But we're gonna start off with. Do you guys see this flat muscle here? Right? This is the most superficial inner thigh muscle, right? And the name of this muscle is gracilis, right? Gracilis. The gracilis is the most superficial adductor muscle, right? And the way I like to remember it is if somebody touches you at this muscle, you say gracias, like, you know, or you say gracilis, you know, because it's actually gracilis, get it, right? You don't say gracias? Say it all the time. Just kidding. Terrible. Oh yeah. No, sorry. Like no one like touches there all the time. But anyway. That's the name of this muscle. It's called gracilis, right? So you guys are gonna find the borders, right? Just like sartorius. Find the borders of the muscles, isolate it, and when you get to the knee area again, you're gonna snip, and then remove that entire flap to expose the other adductor muscles, right? And that exposes you to, I'm just going to talk about 2 muscles here. I'll actually cut a little bit of this one, but can you guys see on this side there's like a giant adductor muscle here, right? And this giant adductor muscle is called adductor femoris. Adductor femoris. So I'm going to go ahead and show you guys. Here, again, just deep to gracilis, we have adductor femoris, the giant adductor muscle, adductor femoris. And again, a lot of the muscles in this region is something femoris because it's right by the femur, right? So adductor femoris, right? This giant muscle here. And then superior to that, do you guys see on this side like this little like darker muscle? So there's a small darker muscle called adductor longus, which contrary to his name is not long. Not in the cat at least. In the human it's long, but not in the cat. So we have adductor longus, which is not long on the cat. That is superior to adductor femoris, right? Which again all share what innervation? Obturator. Let me show you guys on this side. This dark region here, right, is the adductor longus, which is not long. Again, this thing is adductor femoris, and then this little thing is adductor longus. Sounds good? Oh, another thing that I do want you guys to be careful of, I'm not going to grade you on it, but it's a good habit, is you guys see like these blood vessels here? Right, these are actually very significant blood vessels that you'll need next quarter. Next session for 224. So it's a good habit. You guys are going to be using the same cats. So please do not sever the blood vessels. We need it for next session. So if you see like a giant one, save it. Sounds good? That's it for now. So I'm going to go ahead and have you guys get your cats from your bins, right? And take out